Okay, I'm going to go ahead and start. I hope some more folks come in, but we've got a pretty good group so far. So again, my name is Rob Honan. I'm the director of MERIL, and we've been hosting these networking events for some time. Obviously, it would be great to be in person, but it's not very likely for the near future to do that. But we do have this wonderful Zoom virtual opportunity that's better than nothing, but it's nice in a lot of ways as well. So we've been doing this way for at least the last 3 or 4 months. I don't remember exactly how far. We usually don't go in the summer, but probably since August or September, we've been doing this. And the main purpose is really connection. I mean, it's just to make sure that everybody's aware of what your organization does, who you serve, maybe your geographical reach, and anything that's just coming up, special events or anything that you want folks to know about. So that's the main reason for the networking. We used to call it, I still say networking luncheon. It's kind of hard to get out of the habit, but it is the networking meeting. So we're meeting at 10 o'clock these days instead of over lunch. So lunch is on you. So you have to take care of that yourself. So having said that, real quick, if you're not familiar with MERIL, MERIL is a Center for Independent Living that serves 9 counties, and you can see the screen that Christopher's putting up. 9 counties in Northwest Missouri. I'm not going to name all the counties, but they're there. You can see them if you see them on the screen. We have 3 major programs. We have the Independent Living Program, which is offers 5 core services. We have information and referral, independent living skills training, advocacy, peer support, and transition services, both nursing home back into the community, as well as youth transition from high school to either higher education, trade school, or directly to the workforce. So we do have 5 core services in the independent living program. Our 2 other big programs, our biggest, I guess, money earner, our biggest revenue source is the CDS, or Consumer Directed Services Program. This is a program that individuals with disabilities can actually hire their own caregiver to do chores around the house that are approved by the state of Missouri on their plan of care. So you can choose. You're basically the person with the disability is the employer in this model, and the people that they hire are their employees. We help, and just by acting as a financial intermediary with some financial tax related stuff. So that's kind of what we do on the Consumer Directed Services Program. You have to get approved for the state. You also have to be on Medicaid to receive these services. And for this program, you could, even family members, with the exception of a spouse, can be your caregiver in this program. There are some other rules as well regarding transportation and types of services provided that are, I guess, focusing on this program. The other major program, and I'm going to go into assistive technology as well, but the other major program is AT, really falls under the independent living program, but the other one is in-home services. We have 2 different components of our in-home program. We have nursing services, and those services are provided to participants who receive CDS services or in-home services, either from us or another vendor. We would like to keep, obviously, everybody in the MERIL family, but some people get just nursing services from us and they get CDS or in-home from another vendor, and vice versa. There are some folks that are on our CDS and in-home programs that receive nursing from another vendor. So the nursing program it basically does things such as med management, diabetic nail care, skin care, those kinds of things. And then the main part of the in-home program is providing caregiving in the home. Again, it's similar to the CDS program, but there are some big differences. One of the biggest differences is the aides are actually MERIL employees on the in-home program. They don't work for the participant, they work for MERIL. And a lot of times those people on the in-home program would rather not direct their own care. You have to direct your own care in the CDS program. They just want an attendant. They don't want to take the time, or maybe they don't have the wherewithal to find an attendant that could help them out of their own home. So those are 2 of the biggest differences on the in-home versus CDS programs. There are some differences in terms of transportation and shopping as well. So we have the independent living program, the CDS program, the in-home program. Also, we have assistive technology. Those are that program helps individuals with disabilities remain independent through devices. Typically, we have alternative keyboards, alternative mice or mouse for the computer. We also provide magnifying glasses. We work in conjunction with Missouri Assistive Technology, which is a state organization, to provide these resources. There are different programs under the MAT model. There's obviously just straight devices, but they also have what's called a TAP program. And TAP program deals mainly with higher technology. We also do, like I mentioned, the other technology, which can be lower technology and really not technology in some regards. Just for example, maybe reachers or grabbers or those kinds of things. So that's a little bit about MERIL. At this point, we are obviously not having a lot of public events due to COVID. Our office is open by appointment only. If you do want to have a participant, or if you yourself want to come visit us, or if you want to do a meeting in person, we could do that. We social distance, we wear masks. We have lots of hand sanitizer around our office. So we're still open, but we don't have walk-ins. You have to really set up an appointment. If we do have a walk-in, we have a little space up front where they're allowed to meet with one of our staff. So that's one of the things that we're doing regarding the coronavirus. So it's been a very long 8 months, and it's going to be a long winter. We know that. So we're still having these safeguards in place. We do still provide services directly in the home. We've been very fortunate to get some funding through both the state and the federal government for PPE and those kinds of things. So we're still providing services in the homes, and we're taking precautions. We have been affected by COVID. We've had a couple of our in-home staff have tested positive. They're thankfully that they're okay. There's nothing lasting in terms of what's going on. Hopefully there won't be anything lasting. I don't exactly know all their specific cases. We've had some participants that have actually passed away from COVID. So we're very careful on this. So it's been a big challenge for us, but I think we're meeting it with the services and the help we're getting from the Fed and the state government. We're always looking to hire caregivers in either the in-home program or the CDS program. If you know of anybody that wants to work as an aide. Now, one thing I will say on the in-home program, we're only contracted in 3 counties, and I don't think we're contracted in Clinton, or excuse me, DeKalb in Clinton counties. We're only contracted in Andrew, Buchanan, and Nottoway counties for the in-home program, both nursing and the in-home program. But if you know of anybody that lives in one of our, actually you don't have to live in one of those counties. You just have to work in one of the counties. So if you know of anybody that wants to work in Buchanan or Andrew County, let them know about the in-home program. Also, we're still looking for attendance on the CDS program as well. So if you know of anybody that wants to be a caregiver, we're always looking for that. So just give our office a call. Ashley, mainly for the CDS program, Ashley Tucker. You can call me for the in-home program, and I'll get that information to the right person. So,
Rob,
yeah.
do the caregivers have to have a high school diploma or high set?
Not necessarily. You just have to be 18.
Okay.
And pass a background check. And now on the in-home program, since you work for MERIL, it's a little more stringent. You just have to pass a background check for both the CDS and the in-home programs. But the family caregiver, that one, if you're familiar with it, FSGS, I can't remember the exact acronym, but if you're working for MERIL, there's additional restrictions. You have to take a drug screen, and you can't use tobacco. So those are some differences. But yeah, I mean, we're always looking. So that's a really good question. Okay, and real quick, and I know I've talked too much, and I'm kind of broken my own rule of limiting it to 3 or 4 minutes. One last thing, and again, when I turn it over, I'll explain what I'd like for you all to share with us, is the North Star Advocacy Center out of Maryville. This is for anybody here, has 3 hospital beds that they would like to donate to anybody. So if you have a participant, or if you want to grab some for your organization for future use, there are hospital beds available. The message is to please call Janine Montgomery at the North Star Advocacy Center out of Murrayville. And Janine's phone number, and we'll try to get that out to you as well, is 660-562-2320. Again, if you are in need of a hospital bed, they have 3 of them. Call Janine at 660-562-2320. So I've probably gone over my allotted time. And if you could just spend 5 minutes or less just telling us about your agency, what you do, how you're dealing with COVID, maybe some special events that are coming up, and any other relevant information that I think would be worth sharing. So I'm going to go ahead and go down the list here, and I think I know everybody on the call, but I see is I did not see Les Denny from USDA. I'm not sure if Les has joined us or not, and if he does jump on, we'll go back to him. Okay, going once, twice, 3 times, but I know that Rita Walinga is here. So Rita, I'm going to go ahead and turn the floor over to you.
Hi, I'm Rita Walinga with Northwest Missouri Regional Council of Governments, and we hold the contract for the Missouri Job Center here in the 5 counties. So we serve Atchison, Holt, Nottoway, Gentry, and Worth counties. So we have lots of different programs. Are you wanting me to go into our programs, Rob?
Sure. I mean, just maybe your basic high level, what you offer, and just a real quick description of.
So with the Missouri Job Center, we are open by appointment only right now. People can give us a call and we'll set up an appointment. If they stop by and knock on the door, we'll come to the door. If we don't have anybody here, or we can help them right at that time. But we can assist people with helping them file their unemployment. We cannot do it for them. We can answer some basic questions. We have programs that are geared for people who have lost their work, lost their job due to like a layoff or business closure. Individuals for a program for adults who meet the income guidelines. So if they're currently on food stamps, they automatically qualify. And then we have programs for our youth. And I do have our youth specialist here. Denise Hockaday is here, and she works with our youth. And so with our youth, we have some paid work experiences. So if individuals haven't had much experience in the workforce, or they haven't been successful in it, we can try and set these youth up with a short-term experience, as close to something they're interested in as possible. And really it's just to get them in the workforce, get them a reference, let them know what it's like, to go to work every day and on schedule, those type of things. We also have tuition assistance. So for those who are interested in furthering their education, they can just give us a call and we can see what we have available to them. So.
Anything else you want to share with us?
And
you're located in
and we are located in Maryville, 114 West 3rd Street. And so we do have, in addition to those other programs, we do help individuals with resume assistance, help with finding a job, filling out job applications, that sort of thing. We have computers here that we can walk people through those processes.
And anything other like special events coming up? Probably not too many.
Yes,
but,
actually, we do have, this is specific for Kawasaki though, a virtual job fair on November 12th. That's specific for Kawasaki. And then, oh Lord, there are some, if people are interested in furthering their education in like the help desk, like the IT help desk, there are some programs there that are paid for. They're called CompTIA. So there's the help desk IT, and then IT security, the computer cyber security programs. And so, you have folks that are interested in that, have them give us a call, because there's a little bit, it's not a tedious process, but there's a process to be able to get enrolled into those programs that some of the CARES Act funding is paying for. So.
Okay, and for Rita, or about the Northwest Missouri Regional Council of Governments?
The rest of the office is very busy doing grant administration, still working on some flood projects in the Holt and Atchison County, some hazard mitigation, helping to administer a lot of the CARES Act funding that came through the counties. Yeah, lots of projects. I cannot keep up with the rest of the office.
Yeah, and that's the funny thing is that we are busier than ever. It's amazing how, we're a little short-staffed here at MERIL, but I'm busy doing a lot of different jobs, and I think everybody's kind of facing the same way. So I'm fortunate, obviously, to have a job and work, but boy, I've been working, that's for sure.
Right.
All right, anything else, Rita? I'll move on if not.
There are jobs out there, so there are job openings. So I guess when people say there isn't anything, nobody's hiring, that's not necessarily true.
And I totally agree. We have jobs, for attendance and those kinds of things, and
right.
We certainly want to promote any job. Any job's a good job.
Right.
Okay, so thank you so much for the information. I'm going to go ahead and go to Elaine, and I am not going to be bold enough to try to pronounce your name. I'll let you do that again. But Elaine with the Missouri Veterans Commission. So Elaine, you're up.
Oh, thank you. I'm Elaine Gerstenberger. I'm a Veteran Service Officer with the Missouri Veterans Commission. And the Missouri Veterans Commission is a state-established agency established by the Missouri statute to aid all veterans, their dependents, and legal representatives by providing information regarding the rights of veterans and their dependents. MVC, we also assist veterans in accessing their available benefits through the state and federal government. Missouri Veteran Commission operates 3 core programs established by the statute. The Veteran Service Program, again, which I fall under, the Missouri Veterans Home Program, and then the Missouri Veterans Cemetery programs, and then 4 other specialized outreach initiatives focusing on unique needs of certain veterans, women's veterans, minority veterans, and incarcerated veterans, and returning or current active duty service members. The Commission also has an ombudsman who works with unusual and extraordinary issues faced by veterans, service members, and their family. Through these programs, we provide access to veterans benefits that include but are not limited to applications for compensation, service-connected disability, and I'll go into that a little bit here in a minute, wartime pension, and there's a lot of miscommunications on that, so I'll touch briefly on that as well. Education and training, vocational rehabilitation and employment, VA healthcare, eligibility, home loan guarantees, life insurance, burial benefits, and survivor benefits, as well as long-term skilled nursing care and final resting place of honor, which is in the cemeteries. The Veteran Service Program, which again I fall under, we help veterans with any of their benefits, like compensation, VA terminology compensation, civilian terminology disability. That's for any injury, illness, or disease that we veterans may have obtained while we were in the service. There's 42 VSOs throughout the state of Missouri. All of the VSOs are veterans, prior military. So we're able to understand lingo or any dissatisfaction or satisfaction that veterans have within the VA healthcare system. Again, we're Missouri Veterans Commission, not VA, but we work very, very close with VA. Then that wartime pension, that is, I think, what falls more into y'all's program, that we get a lot of calls for the A&A program. That is not the same definition that you all work with. The A&A program for the non-service connected pension, that program, it's a very, very low income program. It's only for wartime vets. It doesn't mean that the vets had boots on ground, but they were in during a designated wartime era. And that is the highest paying rate for that program. So it's just the benefit level. It's not someone coming out and assisting with those types of services. And it does take anywhere from 6 months to a year for that claim to go through. Oh my gosh, I could spend days on it. So we have, there's 7 Missouri veterans homes within the state, 5 cemeteries, and again, there's 42 veteran service officers throughout the state of Missouri. They're for Buchanan County and Buchanan and Atchison County that are up there by y'all. The representative is Greg Fisher or Gary Largent, and they have their office there in St. Joe at the State Building, 525 Jewels, Suite 314. And then Greg does go up to Maryville twice a month. So
Where does Greg meet in Maryville?
He is at the college, and I thought that I had all of that information right here at my hand, but it is actually, if I could figure out how to flip from the meeting onto their address, I would, but I'm afraid that I'm going to lose you. So I can get back with you on that.
And his name is Greg Fisher?
Yes.
Okay.
And their contact number there in St. Joe is 816-387-2841.
Okay. Thank you.
You're welcome.
And is there anything else?
Oh, I have lots. However, I will go way over. So if there is something specific that you all would like to know, please give me a call, because that non-service connected pension program, it's financial based. And again, it is only for wartime vets. Doesn't mean that the vet had boots on ground, but they were in during a designated wartime era. And if the veteran is married, it's marital assets, net worth, and income are included in that. So again, the highest paying rate or level is called the A&A. That is not services that you all are, in your verbiage, that's not what this program is. So we have a lot of confusion with families calling and wanting to get involved in the A&A program, and that's not what this is. Do I have a couple minutes just real quick that I can talk about VA healthcare?
Sure, that'd be great. I'd love to learn more.
Okay. All righty. So VA healthcare, from what I do, is on one side of the pendulum, and VA healthcare is on the complete opposite side of the pendulum. So if a veteran is wanting in-home health care, they have to be enrolled, and they're wanting VA to pay for it. They have to first be enrolled in VA healthcare. and then their primary care doctor, they has been seen in the VA healthcare system within a year of that order. Otherwise, the doctor, they're not eligible for that. Just a little history, real super quick. Prior to 1980, any of us veterans that were enrolled in VA healthcare, there was no financial ceiling that we had to fall under. 1981 rolls around, Congress gets involved, and now any veteran, regardless of the era that they served, gets enrolled in VA healthcare. If they are over income, they're not eligible for VA healthcare. However, there's always a however to everything. So if we can get them service connected, that comp claim, now we've got their foot in the door to receive VA health care. But it is really touchy because DOD told us all when we were signing that dotted line that they would take care of us forever. Well, apparently we need the telehubblescope to see exactly how they're going to take care of us forever, because healthcare is one of the main selling points as a benefit. And now a lot of vets are not eligible for VA healthcare. And the program, oh my gosh, if you would like me to come and talk, or one of my other fellow VSOs to come and talk to your organization, or another Zoom meeting to go into more detail on any of the programs, we would be more than happy to do that, because we could spend hours talking about each individual program. So, all right, I'm done.
Okay, and yeah, I appreciate, this is really good information. Yes, I mean, every one of us has probably at least a 2-hour presentation. Unfortunately, due to time commitment, we have to focus. So Rita Zotto from Clinton County Health Department is up next. So Rita, I think you're on the call, so take it away.
Hi, everyone. My name is Rita Zotto, and I facilitate services through the Adult Brain Injury Program. We serve Missouri residents ages 21 through 65 who have suffered a traumatic brain injury. We provide service coordination, and then we also have rehabilitation services that we provide. Those services include neurological evaluation, adjustment counseling, transitional home and community support, pre-voc and pre-employment training, supported employment follow-along, and special instruction. We've been around for a long time, and so I think a lot of people are familiar with what we provide. Something new that's happened is that Missouri now has a Missouri Adult Brain Injury Waiver, and that's separate from the Adult Brain Injury Program. And the waiver also serves adults with traumatic brain injury age 21 through 65 who suffered a traumatic brain injury. The services that is included with the brain injury waiver is they also do the service coordination, but they pay for different services. The individual has to be on Mo Health Net or Missouri Medicaid. And the services that they provide is personal care, applied behavior analysis, assistive technology, cognitive rehabilitation therapy, environmental access and modification, neurological evaluation, occupational therapy, physical therapy, and speech therapy. And if you know anybody that would benefit from that, they are to call the special healthcare needs at 1-800-451-0669 and ask for the Brain Injury Waiver Service Coordinator.
Okay, Rita, is that anything else?
Nope, that's all I have.
Thank you. That was short and sweet and a great program. I have to say that we've worked with her and I need to get back with her to pick up. We've lost a couple of staff members that helped us out with our brain injury program, but Rita does a great job advocating for and getting good information out there. So thanks again, Rita.
You're welcome.
Okay, the next, and I don't know if Lana is with us. Is Lana with Second Harvest here with us today? Let me look. Let me look at the participants list. I don't see her. Okay, if she does show up, we'll certainly allow her to talk. Next, we have Clinton County Senate Bill 40. Is Amanda or Amber available? I didn't see you all, but sometimes I look at something and stare right at it. And all right. I think Sonia is here with Catholic Charities. So Sonia, do you want to, I'll allow you to take it over. So go ahead, Sonia.
How come? Can you guys hear me okay?
Yes, I can definitely hear you.
Okay. Hi. Hi, my name is Sonia Campbell with Catholic Charities. I'm currently what we call the Community Housing Programs Manager. I currently have 5 different programs. We have the Northeast Metro Permanent Housing Program in Kansas City. We have the Northwest Housing Program in Maryville. And then we have 2 programs here in St. Joe Permanent Housing and Home Plus, where we house around 50 different households, including children, people that are chronically homeless, different things like that. What I would like to do is tell you a little bit about what Catholic Charities does. We have an office in Kansas City and we also have an office in St. Joe. We have different programs for different things. We have a Germain's Little Lambs for women that are pregnant or have children, that they can come to the office in St. Joe or Kansas City and get supplies such as diapers, baby wipes. We do parenting classes with them also. And during COVID, we've been doing parenting plans via Zoom, or we also have something on Facebook where they can go and watch the programs live with that program. So we still give the parenting classes and different ways of teaching them and helping them cope through this difficult time. For that, the St. Germain's Little Lambs program goes Jackson, Clay, Platte, Cass, and Buchanan County residents. Sometimes we hit Clinton and DeKalb. We actually have a case manager over there. So if you know anybody that's pregnant or has babies interested in parenting classes or anything, you can give us a call here at the St. Joe office and we put them in contact with that case manager and help them with those skills and training and getting them the supplies they need to help them during this time. We have employment services also through. We have Jennifer Tatro. She also has a DOC contract. So if you have parolees that are getting out that need help with rent assistance, also utility assistance. Sometimes they get out of being in corrections and have old utility bills or something that they need taken care of before they can help them get back on their feet. She offers that program too. And that is for the surrounding counties. So she can help get them back on their feet, set up rent, utilities, help them find a place to live. She gives them gas cards, bus passes, whatever they need during that time. So that's kind of a great program. We were doing, she also helps them with, she does a lot of outreach, sometimes in Maryville too. Sets up classes up there at the Catholic Church there in Maryville, where she does outreach and they can come in. She helps them get their resume and everything set up. So when they leave there, they will have a little flash drive with their resume. She prints off the resumes for them, helps them find employment after they're done with their incarceration. We also have the Welcome Center in St. Joe, which is open Monday through Thursday from 1 to 3. We work Monday through Thursday, 8 a.m. to 5:30. So they're welcome to come into the Welcome Center from 1 to 3:30 during Monday through Thursday, and we can help with hygiene items. Sometimes we can help with rent, utility bills, depending on our funding at that time. Right now, we have what we call CARES Act funding. So today and Monday and possibly Tuesday, depending on if our money runs out, they can come into the St. Joseph office, bring their ID, their birth certificate, if they have past rent that they have due, if they have past utilities that they have due, bring them into the office, copies of those, and we're helping to pay those expenses for those people during this time. So if you know anybody that you have on your client list that needs help with those utility bills, rent bills, anything like that, have them bring copies of those, a copy of their lease if they're asking for rent assistance, and we can help during that time. And it's today until 5, and then on Monday from 8 to 5:30. So anytime during that, if they bring those into the office. Again, like I said, we help with the basic needs, different things like that. We also have for our permanent supportive housing, if you know somebody that is chronically homeless or homeless, we have a case manager in the office that does assessments with them, to get them on a prioritization list. So, and then there's different programs other in St. Joe, Kansas City, that pull from that list to help them find housing. And I think that is just about all that we do. So, but we've been trying to do the virtuals and get everybody, you know, we have the funding that we would like to help everybody out that we can. So the more people that we reach, the better it helps. So I appreciate you guys for doing this virtual so we can get the word out.
And we appreciate all the work you guys do as well. It is nice to at least have the virtual option.
Yeah.
I think a lot of people have Zoom fatigue, but I mean, it works well. And obviously, I'd love to see you all in person. It's much better. You actually exchange business cards, give out physical brochures, that kind of thing. But this is the next best thing.
Yep.
Hey, thank you so much, Sonia.
Thank you. Have a great day, guys.
You too. And I don't think we have, is Tausha here with Missouri Department of Mental Health? I don't think she is. I didn't see. So I do know that the next two are here. So Linda, go ahead and take it away from Nottoway County Services, Turning Point Behavior. So Turning Point Behavior and Crisis Services. I didn't read everything. So Linda, you're up.
Yeah, it's a long title, isn't it? So I am the program manager with Turning Point Behavior Services, and our division has been in existence with the agency for just about a year and a half now. One of the things that we're doing to respond to the pandemic is because in our administrative building, we've got a lot of people in every office. There's usually 2 to 3 people per office. So we are alternating the days that we are in the office so that it's, we've got the schedule worked out so that there's generally only one person in each office. So as you can see, I'm working from home today, and you might have noticed over my shoulder is my lazy housemaid asleep on the pillow. So let's see. To go into more detail about what we do, we primarily serve individuals with developmental disabilities who are having high behaviors. They may live in group homes, ISLs, or with their parents. We now have, instead of just one behavioral analyst on staff, we now have 2 certified behavioral analysts on staff, one of which is Mark Para. And for a time, he was serving as the interim director for the agency, and now he has been named the full-time executive director for the agency. So in addition to doing that, he's still our clinical supervisor for a portion of his time. So our behavior analysts can also go into school settings and consult with the educators. We focus on a 7-county area, which is Nottoway, Atchison, Andrew, Buchanan, DeKalb, and Gentry and Harrison. We have a new group home that is a 90-day transitional home focusing on people with high behaviors. So if there's an individual that has maybe been given notice by their provider we can bring them into our transitional home and evaluate the situation, identify triggers, determine ways that support staff can help that individual to be successful. And we have a focus on reducing any restrictions they might have. And then at the end of those 90 days, whether they go back to the same home they were living in or they transition to a different provider, our staff goes in and trains the new staff how to support that individual. So right now we have 2 individuals in placement with us. We're looking at a third maybe joining in December. But things are going well, and we're learning a lot of new things on this adventure that we are on. In addition, we can also provide training to different industries on a contractual basis. So some of the things we can provide are organizational behavior management, leadership training, supervisor training, ACT training, which is based on acceptance and commitment therapy. And that helps a lot with staff burnout, teaching mindfulness practices. It's really awesome. If you haven't heard about it, I encourage people to look into it.
Excuse me real fast, Linda. What was that called again?
ACT training, it's spelled ACT, and it's based on acceptance and commitment therapy.
Okay, thank you.
Yeah, you're welcome. So while we currently still offer person-centered strategy consultation, the departments of mental health had decided to phase out that service at the end of February because of budget cuts. So we still have that service, but we are making plans to discharge individuals, and then we'll revert completely over to our focus on the behavior services at the transition home, or we did get approved for the crisis service contract, although that's brand new, so I don't have a lot of information about how that's going to roll out yet, but really appreciate the opportunity to tell about our services. And does anybody have any questions?
And just as a reminder, Christopher will be sending out information after the meeting. And if there are questions, you could certainly call Linda or any of the other speakers after the meeting. We'll get that information to you, but really good information. I appreciate it, Linda, for you sharing what you have.
You're welcome.
All right. And I think the last speaker is Gwen. So Gwen, I know you're on the call. So Gwen, I'm going to let you take it over.
Hi, yes. My name's Gwen. I'm with the Source Medical Clinic. We're located in Maryville, Missouri, and we are on South Main Street, right next door to what used to be Radio Shack or what is Best Brands, right down from Orchlands. And we're an acute service clinic where we service women who are in need of pregnancy help. We do medical applications such as pregnancy testing, ultrasounds. We also do STI and STD testing and treatment, and that's for men and for women. We have continued to be really busy through all of this. We are considered essential, so we have been open. Back in March, we did have some limited hours and appointment offerings, but now we're just going to stay open, just, unless things get really, really bad. But of course, we have all kinds of precautions in place, similar to other medical facilities. I think that we have also had a particularly important part in the community where there was the period of time where women were not going in to get their prenatal appointments because of coronavirus, but yet we were still seeing women then come in for just that acute service. And what I mean by that is we serve more like the walk-in clinic where somebody can come in here to just get an acute assessment or treatments, but we don't do ongoing prenatal care, or obviously we don't deliver and things like that here. So we have just been really busy trying to intercept women who are not getting medical care, who are pregnant, women who are trying to make pregnancy decisions, and things like that. Also with STI and STD services, there just isn't a, with the way it's been with all the coronavirus, people are not able to walk in, or they weren't for a while. Things are getting a lot better, but so we've been able to kind of stand in that gap and serve people. All of our services are free. We are not an income-based organization, so anybody is eligible to come in and use our services. We have not felt we've been taken advantage of, where people who have access or insurance or funds for other care use us unnecessarily. We really feel like anybody that comes here has a need for what we have, but oftentimes it's thought that we are income-based, but we are not. So we are not just a low income serving organization. We serve all demographics. Students also, even though the wellness center has been open, they still have had some barriers to medical care that we've been able to step in and deliver those services. And because we serve men also, I think that men oftentimes are left out in community offerings. There's much more of a woman focus with community services sometimes. And so we've been happy to kind of be that person with men. But so anyways, those are kind of our medical services. We also have parenting classes, and where people who are pregnant, men, moms, dads, and couples can come in and do an education. And we have a facilitator that delivers that curriculum. A lot of it is cast or streamed, so they get both the electronic component and then a personal component. And we feel like that's a really important aspect today, because there is such a feeling of disconnect and loneliness throughout our communities, especially, during coronavirus, and mental health is a real issue. A lot of depression, again, a lot of loneliness, and our moms that are coming in, they just are desperately wanting that personal connection with our mentors and our facilitators. So again, we feel, because we are essential and can take proper precautions, that's been an important way that we've been serving in our community, because as we all know, mental health is just as important as our physical health. If our moms aren't healthy mentally, they're not going to be the best moms that they can be physically and otherwise. So we are just happy to be able to walk alongside moms and families in that way right now. Again, no income requirements for those services or classes. They can receive material goods as incentives for completing their classes. So all of that is also free. Most of our stuff is donated, and our goods are mostly new, so that we can make sure that everything is meeting safety standards and nothing is hazardous. Before we worked in schools and in different other organizations providing prevention, like risk avoidance behavior techniques and advice. Some of that has continued on Zoom, but that's kind of out in COVID world right now, where we're doing a lot less of that. But seeing how we're doing a lot more in clinic right now, it's kind of been a nice break. But we're anxious to resume, because we really believe in messaging to young people in ways that they can learn to advocate for non-risky behaviors themselves, so they don't find themselves in situations needing kind of acute health services like we offer. I don't know. Does anybody have any questions about what we do? Or we don't have any geographic requirements either. We serve all tangent counties to Nottaway, of course, including Nottaway. We will serve Iowa patients or client participants from Iowa. We try to direct St. Joe to St. Joe or Andrew County, Andrew and Buchanan. There are duplicating type services down in that area. So we do try to reserve our resources for more up in this area because there's a much higher need than down there.
So thank you so much, Gwen. Are there any questions? I mean, it's another valuable service that we have in the community. So much needed service. And I think that's wonderful that you guys do a great job and good information. It's nice to know the geographic reach that you do, that you're making a referral to St. Joe if it need be or wherever. But again, thanks a lot for joining us.
Yes.
What Gwen said, I just want to make one comment about MERIL. I did mention that the in-home CDS programs, you do have to be Medicaid eligible. On the IL program, there are no income requirements, with the exception of some of the AT or devices that with the program, with the tap for telephone and the tap programs. But for the most part on those IL programs, there is no income eligibility. So I think that I'm glad you brought that up, and it kind of reminded me to share that with you guys. So we're at the end of our networking. I always have to say networking luncheon, but it's a networking meeting today. Are there any additional questions or comments before we sign out? And I know Christopher, he does a fantastic job of getting the information out to you all. So he really does a great job of organizing this and putting the screen up. So I just want to say thanks again, Christopher, for the job you do. But are there any other questions or comments that maybe you missed when you wanted to say it before and now came to your mind, or anything like that?
This is Elaine Gerstenberger with the Missouri Veterans Commission again, and I did forget to make mention that we do have an app for the Missouri Veterans Commission, and it's a great resource. And I was able to pull up Rita Gregg's information for Maryville. His office is at the Volk Center, West 7th Street, there in Maryville. The telephone number is 660-562-1710. And the services that the Missouri Veterans Commission offers to fellow veterans and their family members, it is completely free. No veteran should have to pay to come in and talk to anyone in regards to what they may be eligible for. That's all I have. Thank you.
And that's good to know about eligibility. So anything else?
What number do they call to enroll for the vet program?
I'm sorry?
What phone number do they call to get enrolled?
Enrolled into a specific
In-home
program?
health, to the in-home care or something?
Okay,
For veterans?
in-home health care, that is strictly through their VA provider, their primary care doctor.
Okay.
So anyone that is coming to the Cameron CBOC stands for Community Outreach, Community Outreach Clinic. I completely messed that up. Anyway, they would call their provider here. That telephone number is 816-632-1369.
Okay.
And and they would have to, of course, schedule an appointment, talk with their primary care provider, and request in-home health care.
So if they were going to say Leavenworth, they would still have to get their primary care to get a hold of.
They would call their primary care physician there at Leavenworth. I'm sorry. So
Okay.
the VA healthcare is set up in regions. So any veteran that is going to, or catchment area, any veteran that is going to the CBOC there in St. Joe or Platte City, they are tied to the Leavenworth Hospital, VA hospital.
Mhm.
Any veteran, regardless of where they live in the state. So any veteran that is coming to the CBOC here in Cameron that is getting ready actually to move into their new building December 4th or week of December 4th, this clinic and the CBOC in Excelsior Springs, they are tied, or we are tied to the Kansas City VA hospital.
Okay, thank you.
Uh-huh. Did
Okay,
you need those numbers by any chance? The hospital numbers?
sure, if you have them, and we could send them out as
Okay.
well, but if you have them.
Oh, okay. All righty. The Kansas City VA hospital number, just real quick, 816-861-4700. And that's the main number. So just have them ask for their provider. And then the Leavenworth number is 913-682-2000. Thank you.
All right, anything else? And this is all great. There's no worries about time. We're right at the hour. We have a couple more minutes, but any other information that people forgot, or are we good to go to sign off? Going once, twice.
I do have something to add. So if you know people who are laid off from their job and they need to file for unemployment, they need to do that immediately. Like if they were laid off yesterday, they should be filing for unemployment today. Do not wait, because then that's potentially a whole week that you might not get paid for. So they need to file immediately, and lots of individuals are actually able to file for unemployment even though they're quarantined from work. Maybe they were exposed and so they're quarantined for 14 days. They can still file, but they need to do that immediately. So lots of folks have been waiting, and then they have to go. It makes it a much messier process, because then they have to call the claim center to try and get that backdated, because we can't do that here. So that's just, and they need to read everything that they get. Read it once, read it twice. But that's just because we've had a lot of people call and they've waited a week or 2 weeks, and it just makes it a lot messier process for them. So.
Good information. I mean, I think it's very important that people stay on top of it. So thank you so much. All right. I was at 3 or 2.5. So anything else? Well, I want to say thanks again for joining us. And these are very, very valuable. I've learned so much today. It's really nice to hear from everybody. And I think that if you have any questions, just get a hold of us and we can connect you to the speakers, or get a hold of the speakers directly as well, because I think Christopher sent that information out. So I'm going to go ahead and sign off and want to say thanks so much, and we look forward to the next time. And one thing, and I forgot, is MERIL does have an office in Maryville. I don't know, a lot of you already probably know Lauren Lynch. So we have 2 offices. We have one in Maryville, and I know we have a lot of Maryville folks on this call. So feel free to get a hold of Lauren, and that office is over at 24 South Main. That phone, and you can just call our regular number and we could transfer it up to you, which is 279-8558. So I appreciate that. And anything else, if there's nothing else, I'm gonna go ahead and sign off. Going once, twice. All right, goodbye, everybody. Have a great month. Take care.
Thank you.
Thank you.